Good afternoon, everybody, and welcome to Workshop 1, which is Good Work for Good Health, Building on Success at a Local and Regional Level. Before I get started, can I just check that everyone who is here in this workshop is meant to be here? If there's anyone here who wanted to go to a different workshop, can you just say so in the chat? Because we'll have to give you a chance to do that. Otherwise, we'll press on as we are. Nope. Great. Then what I'm going to do is just present this slideshow. Hold on a second. Let me see if this works. Can you see that slideshow? Yeah. So what we're hoping to do in this workshop is give you some space to imagine what good looks like, what we could achieve if we work together for improving access to work. And what we're hoping you'll be able to do is go on a little bit of a journey during the time you've got to discover what's really good about what we have. So we're going to start by asking you to think about a time when you've been involved in delivering something together, something you're really proud of, and what is it that you really loved about it, what worked really well, and try and be specific when you discuss this issue, because it's about trying to relive those times when we've really achieved something and understand what it was that made that happen and made it work well. Then we're going to also ask you then to have a look. We've laid out some example personas, so some different types of people who are facing challenges related to COVID and getting good fair work as part of that. So if you have a look through the options and on your table, hopefully if you can have about 5 to a table, if you use the tables, the 6-seated tables, that will leave room for us as facilitators to join you during the session. So if you go to those tables and just have a look through the different characters that are there, and choose one of them to think about what you collectively are already doing or what's already been done to support those people. What's happening well? What are we doing well in Wales or locally and regionally? And then start to think, well, what if this was even better? What would great look like for this person? So figure out those things that would really improve the experience of this person. And then finally, towards the end of the discussion, it's about picking out just key things that need to happen right now to move us into the action phase. To help you do this, you're going to have a document put in the chat, which will describe the phases that we're asking you to go through, the questions to answer. And we've also put indicative timelines just to try and keep that conversation moving. It's a lot to get through in the time we have, but I think it will help to get us through to get as much out of this time as we can. We'd love to get the depth of your discussion. So if one person at the table can just capture some of the things that are being said, some of the key, there's a table chat facility, so you can use that. You could create a document on your computer and you can write it there, or you can just physically handwrite notes and take a photo of it and either upload the document to the chat or email it to us in the network. That'll be really helpful because I think there'll be a depth of richness here that we don't want to lose. And then come back and tell us your key points, and we'll be able to share that with the rest of the group after. So is that any questions around that? Is that reasonably clear? I don't have any questions, so I'm taking that silence as being agreement that all is okay, but please do say if not, and we'll send you back to your tables now. And if you can, as I say, go into the 6-seated tables, leave a space if you can so that we can wander around and just check how things are going. And if there's not enough space at the on floor 1, you can move to other floors. But hopefully there will be, and we'll help sort it out if not. So I'm going to ask Marie if you can move us back to the tables, please.
We will do is we can switch your camera on then, and you can give the feedback. So yeah, if you'd like to press whoever's nominated to give feedback, if they'd like to raise their hand. So we were in conversation and made it through. You've been pulled through. That's brilliant.
I've been pulled through.
Yeah. Okay, that's great. So yeah, if you'd be willing to, I know you did look at some of the questions we asked, but I know you were having a bit of a broader conversation. But yeah, if you could feedback at some of the main points, that'd be great.
Of course, yeah, a pleasure. It's a really broad discussion in our group. So we did try to stick to the questions, and we did start talking about things that we'd achieved, and trying to pull out sort of some of the key success factors of what we'd achieved, and sort of that's what we spent our time discussing. So we started off by talking about examples of when we've worked with private sector businesses to help them to invest in creating the right conditions for creating healthy workplaces. So we talked about the need for investment and the need for simplifying a complex landscape so that private sector businesses are able to engage easily, because many of the businesses are small and micro businesses, and therefore they don't even have a dedicated HR advisor, and therefore being able to simplify that system, even consider incentivizing employers to be able to introduce some of the conditions for creating high performance workplaces would be beneficial. We said that none of that would work unless co-production and collaboration was taking place, because where it works best is where the private sector, the third sector, and policy comes together. So we definitely thought that that was a key element of success. We also agree that there needs to be a lot of working in terms of locality and being able to demonstrate that the local pound is being reinvested, so that we're demonstrating social value. So people who are being paid to deliver contracts are able to demonstrate how they're helping individuals locally to benefit from the investment that the contract holders are securing, basically. So and then finally we talked a little bit as well about the importance of society in place, and how in terms of local authorities, in terms of creating good work and good health, you have to have good employers. Good employers invest in places that look nice, have good skills, have good infrastructure, etc. So we were talking about actually the importance of a good place links directly to good health, and the attractiveness and the quality of jobs. And then finally we talked about precarious work and how in effect, precarious work isn't always bad, but it is when the people who are engaging in that don't have the same access to the employment rights and benefits and things like being able to demonstrate income so that they can secure a mortgage. So we talked about considering underwriting some areas of precarious work, and I think that's about all we covered.
That's good. That's a lot of points you
we
covered
did.
Really big, broad areas. So that's really good. But yeah, thank you. And that's a really interesting point, because I just joined your conversation about precarious work and the nature of some people having short-term contracts, and that in itself is not necessarily a bad thing. But it's when, like you said, that to do with the sort of worker rights and important aspects to make it good work. Okay. I'd like to get feedback from one other table now. I'm not sure who's going to. Kieran? Oh, Kieran's willingly going to give some feedback. Thank you very much, Kieran.
Hi. Our table came together a little bit late, and so we didn't kind of carry through probably the approach that the other table did, but there's some really interesting points and conversations. At the start was a point about the importance of autonomy for good work, and how even in our own organizations, sometimes we don't make sure that happens as much as it should, to allow people, have the control over their work and have the responsibility and the autonomy to deliver and to influence. Something in that about just what we can all do within our own environment. We discussed the particular scenario of one of the scenarios was Shan, who was a hairdresser with childcare issues, only to find out that one of the people at our table had basically been dealing with an individual almost identical to the scenario that we had, and that really helped us explore the value of the Communities for Wales Plus approach. So there was a lot came out about good things that are happening already, and it was described how that an individual had been helped in terms of upskilling their existing hairdressing skills, getting childcare support through PACE to look after childcare arrangements, and also reskilling in terms of then coming to actually work in a nursery environment and set off on a new career direction. And I think the amount of kind of support that this individual got from many agencies was a great example of good working. Another positive example of how we currently contribute to good work is the Healthy Working Wales programme, and how that ensures that employers support people into work, and particularly those perhaps with less, a less academic inclination, and for example, people with learning disabilities having good opportunities through the Platinum Award scheme for employers. Community support was also evident through Well North Wales, which focuses on a community approach, alleviating poverty, involving social prescribing, COVID-19 hubs, giving debt. So there was quite a number of really powerful initiatives. And in terms of what else was needed, I think the focus was on that community. The lack of face-to-face support has been sorely missed during the pandemic. It was described that some young people have been suffering from great anxiety, engaging through text messaging, but not wanting to turn their camera on because of the levels of anxiety associated with the isolation. So the need to get into the community and really help people to overcome those anxieties was felt to be an important next step. I'll just ask, I don't know if either of the two on the table want to add anything to that, if I caught that reasonably. If you want to say something in the chat about it. But that was our summary.
Thank you very much, Kieran. So quite wide-ranging conversations there. What we're going to do now is go... Oh, sorry, Trish, you're just...
Oh.
Hi, Trish.
Yeah, no, I was just about to pop it into the chat, saying that Kieran was absolutely spot on with certainly what I'd said about Community for Work Plus and the work that we do.
Okay.
So thank you.
Yeah, unfortunately, it doesn't look like Trish can connect with us. So I suggest now that what we do is move back to the main plenary session. So in order to do this, you'll need to join workshop 2, which is I believe the orange button, and then we pull back to the main plenary for the final summary. Thanks a lot.